Hello, and thank you for joining us for our webinar, The Cost of Canceled Appointments, How to Prevent Open Slots and Recapture Lost Revenue. I'm Adam Rubinfire, Content Manager at Phreesia, and I'm excited to be moderating today's webinar with Athena Health. Today, you'll learn what to do to prevent last-minute cancellations and quickly fill gaps in your schedule when they occur. Before we get started, I'd like to quickly share some housekeeping notes. Attendees can submit questions at any time using the Q&A widget on the right-hand side of your screen, and I'll ask as many questions as time allows. In the resource widget, also on the right-hand side of your screen, you'll find a one-page overview of Phreesia, information about our smart scheduling tool, appointment accelerator, details about how we can help your organization increase revenue, and a case study about how B-Bay Medical Group used Phreesia's appointment accelerator to fill cancellations at both its primary care and specialty practice locations. If you have any technical difficulties, don't hesitate to reach out, and we'll try our best to help. Since it's always one of the most frequently asked questions, this session is being recorded, and you'll receive a link by the end of the week. Now, I'll start our session off today by introducing our amazing panelists who are both Athena users. Next, I'll discuss the cost of cancellations, the cost that they can have on your healthcare organization, and offer some best practices and tools that you can use within your organization to prevent cancellations and fill the empty slots they leave behind. Finally, we'll spend the remainder and majority of our time in a discussion with our panelists. We encourage you to send in any questions for them that you may have throughout the webinar, and we'll get to as many as we have time for. Speaking of panelists, I'm thrilled to introduce them. We're so lucky to have them with us today. Erika Delarm is practice administrator at Women's Health and Surgery Center in Stafford and Fredericksburg, Virginia, where she has worked since 2013. She started at Women's Health and Surgery Center as nursing manager, became operations manager in 2019, and was promoted to practice manager in the summer of 2021. Holly Searcy is director of clinic operations at HeartPlace, a 70-provider cardiology practice in Texas, where she worked for nearly 2 years. She previously worked at Low T Center and HerCare, where she supported 11 states and over 50 offices for 7 years. Thanks for joining us today, Erika and Holly.
Hello. It's great to be here. Thanks.
Excellent. Well, let's get right into it. So finally, just before we get right into it, finally, a few brief words about Phreesia. Phreesia is guided by our mission of creating a better, more engaging healthcare experience for patients, providers, and staff. I had over 120 million patient visits annually. That's over 1 in 10 across the US. Our digital platform helps healthcare organizations enhance the patient experience, drive efficiency, and improve healthcare outcomes. We have real-time integrations with all the leading EHR and registration, scheduling, and billing systems, including Athena Health. We're a publicly traded company on the New York Stock Exchange, and we've been rated #1 in patient intake management by the research and insights firm KLAS 4 years in a row. Our security and privacy efforts are recognized with the industry's top certifications. And if any point during this webinar you have questions about what we're discussing today, or you're interested in learning more about how we help healthcare organizations prevent cancellations and quickly fill gaps in the schedule, you can request a consultation using the form in your webinar console or visit Phreesia.com. Now, let's start talking about cancellations, because I don't have to tell anybody here that a canceled appointment is bad for business. I do, though, want to share just how significant the impact of cancellations can be on our industry. Missed or unused appointment slots cost the U.S. healthcare system a whopping $150 billion a year in lost revenue and costs for provider staff who are not being used effectively. Providers and staff, I should say, who are not being used effectively. Each unused slot represents as much as 60 minutes of time in which providers and staff are not seeing patients. And some procedures, it can be even more than that. And that's estimated to cost an average of $200 per appointment slot in physician costs. And that doesn't even include the cost of your administrative staff. And when you're an organization that's caring for vulnerable patients like an FQHC, a safety net hospital, or another provider that serves significant Medicaid or uninsured populations, an open slot is a missed opportunity to be advancing your critical mission. So how can we get ahead? How can we prevent costly cancellations and fill gaps in our schedule quickly when patients must cancel? Well, let's talk through some tools that you can use to do that. Appointment confirmation is key to having a predictable schedule, and technology can help. But how you implement that technology it's important. It's important to reach out early to confirm appointments and have redundancies in place if patients are non-responsive, all automated so that staff can stay focused on other tasks. Phreesia's best practice is to send an initial reminder to patients via text and or email 5 days before their visit. If they confirm then, they typically won't receive any further messages before their appointment. If they don't confirm then, we'd say you should send a follow-up reminder 2 days before. And if they don't respond to that, an automated voice call that can leave a voicemail is a great tool to ensure patients are aware of their appointment. It's a different medium to get the attention of patients who aren't responding. Now, in all of these cases, providing reminders in the patient's preferred language is a great way to ensure they understand when their appointment is and how they need to prepare. On our platform, many of these settings are customizable. And if you want to learn more about that, feel free to request a consultation and we can talk you through some of those options. But by asking patients to confirm their appointment with time to spare, we ensure that we're not forced to fill their slot at the last minute. So some patients just need to cancel. They just can't make their appointment. So when all else fails, we need to fill that empty slot as quickly as possible to avoid losing that revenue and so that we can retain that patient in the long term. A smart scheduling tool automatically fills unexpected gaps on your schedule due to cancellation and rescheduled appointments, and it moves high priority patients up in the schedule so that they can see a provider more quickly. Patient retention is critical, not just to short-term revenue, but also to the lifetime value that a patient could bring to your practice. Let me briefly share how this works. So when a patient cancels an appointment, the tool automatically identifies clinically relevant patients with upcoming appointments based on customizations designed by the healthcare organization in consultation with your implementation team for the tool. It then automatically sends those patients a text message offering them the opportunity to claim the earlier reopened appointment slot. So the first patient to reply with that text, it's often, text win or text any random word. The first patient to reply gets that appointment. No waitlist signups, apps, portals, or staff work required. A smart scheduling tool can also reschedule patients if they no-show or they're bumped, and it can fill underutilized provider schedules by moving patients from an overbooked provider to a provider with more time on their schedule. So we're doing all of these things without any staff intervention. Now, I just want to talk a little bit more about these kinds of tools. A smart scheduling tool, our tool, Appointment Accelerator, it saves providers time and lets them do away with wait lists, which are inefficient and staff, and they're inefficient and staff spend a lot of time calling patients on wait lists. We actually find that a lot of organizations simply just don't have a wait list because it's not efficient. Appointment Accelerator can actually, it can identify and contact patients so you can fill most appointments in under 5 minutes. And it automatically fills 1 in 5 last minute cancellations. So we're talking down to the wire that staff likely otherwise wouldn't have had time to fill. Filling gaps quickly is critical. Competition for patients is fierce. And if you have a long wait list, patients may not want to wait. They're going to be more likely to shop around in for an appointment, and none of us want that. All right, with that, I'm going to launch into our Q&A, and I will go ahead and stop sharing our PowerPoint here so we can see our lovely panelists' faces. Audience, if you have questions for our panelists, please send them in via the Q&A widget on your console. If we don't get to your question today, we'll be sure to follow up after. But I would love to start by just asking our panelists to share a little bit more about your organizations, your facilities, the patients you serve. Erika, can we start with you? Tell us a little bit about your organization.
Hi, my name is Erika Delarm, and our organization serves the Stafford, Fredericksburg surrounding areas for OBGYN care for the community, and I'm just really glad to be here.
Excellent, excellent, excellent. And Holly, what about you? Tell us a little bit about HeartPlace.
Sure, yeah, absolutely, Adam. So HeartPlace is the largest independent cardiovascular group in the state of Texas. We've most recently partnered with U.S. Heart and Vascular, so hopefully soon to be more a national platform. But we offer general cardiology, interventional cardiology, imaging, things of that nature for the cardiology specialists for the community throughout all of DFW.
That's fantastic. Well, we're happy to have you both here, and we're here to talk about cancellation. So I would love, to kind of get into this conversation to start with what's the impact that cancellations have on your practice? How do they disrupt operations? How do they impact revenue? Do they lead to inefficiency for clinicians and staff? Erika, let's start with you. What impact do cancellations have?
It has a tremendous impact. It not only for our providers, but our clinical staff, our administrative staff, all the preparation and work that goes behind the scenes, preparing for that patient to actually come in and be seen. But when they do last minute cancellations or no show, all that work behind the scene just falls at the wayside.
Yeah, it's really
It's
interesting.
unfortunate. Yeah.
Yeah, absolutely. Yeah, Holly, what about you? What impact does cancellations have at HeartPlace, and how do you try to get ahead of it?
Sure, yeah, absolutely. So definitely seconding Erica's statement as it relates to all of the administrative pieces that have to be in play in order for the patient to come in and have a seamless experience. Whether it's, needing to know if we need a, translator there, insurance, all of those little pieces make a large difference. So in order for us to make sure that we have everything aligned to have the most efficient use of time for everybody within that patient journey, we definitely prioritize the cancellation piece. And if we didn't have this product in place to help with that, we would be very, very challenged, especially given the labor market right now as well.
Yeah, and we're going to talk about that a little bit. Let's talk about Appointment Accelerator a sec. That's Phreesia's smart scheduling tool. Holly, you're using it to quickly fill slots after somebody cancels or gets bumped or needs to reschedule. Tell me about how you've implemented it and what kind of results you've seen.
Yeah, so Appointment Accelerator for our frontline teams have been huge, just in the instance of we're really trying to focus on that patient-centered care, patient experience. So when my patients are in the building, I would love all the attention on them and not those other nuances that, they come with it. It is what it is, but this helps with that equalization of those duties by pushing some over to the tech side, therefore allowing that higher impact on that patient experience in our clinic. So implementing it was actually a want, if you will. Everybody was begging for it after we illustrated the impacts that it would have and what it could do for them in their patients and help, again, equalize just that distribution of work. So we are continuing to roll it out, getting more comfortable with it and things of that nature. And it's been a real success for us here at HeartPlace.
That's great. And I assume your staff would much rather be spending time. I mean, that's why people get into this career, correct?
Yep, 100%.
Yeah, that's great. Erika, what about you? Tell me a little bit about how you're using Appointment Accelerator at your organization and what you've been able to achieve.
Well, we have been able to achieve a lot with it. The patients love it, especially when it comes to OBGYN. They want to have that ability to get in sooner. If they're having a problem, they don't want to wait for that weekend. But there's also been times where it has worked so well, and with providers on vacation and needing the slots, the open slots for patients that actually we need to contact to come in. I've had to a couple times put that Appointment Accelerator on pause because it was so efficient that it was just capturing those appointments quicker than I could grab them. So that definitely has happened more times than one. So it does work very well.
That's fantastic. I mean, one of the interesting things of that is I do know that, like you said, sometimes when we have limited providers, that can be an issue. But I do know that, sometimes when folks bring on a new provider, that it can help kind of fill that schedule pretty quickly. Holly, you looked like you were.
Yes, 100%. It's a beautiful tool to use, for marketing and things of that nature, where I'm just giving out someone a link or a QR code in the marketing efforts that we're doing, because it just makes that ease of utilization the best and the most efficient is what's going to, reach that capture of that patient.
Yeah. Yeah. I mean, it can be hard to bring on a new provider because, folks don't know them and they're probably really great, but it takes time to get people excited and interested with a new provider. Holly, I'll stick around with you because I know one of the things you've told me is that you're piloting Appointment Accelerator for diagnostic and imaging appointments like nuclear stress testing, for example. Can you talk about why you're using Appointment Accelerator for these type of appointments and maybe why it's important to rescue revenue from when patients cancel these kinds of appointments?
Yeah, absolutely. So first and foremost, again, kind of going back to the initial narrative of the story, just being that the human capital or admin pieces that are very much involved, of course, with those higher returns, especially being those in-house testings and those clinical pieces that we have to make sure that our patients are prepped for are huge. So handling those much more delicately because of those prerequisites or requirements in order for the patient to meet those, to have an appropriate testing to get whatever results it may be, are imperative, if you will. So utilizing this helps keep that schedule full, because those are those appointments that are even more anxious, I would say, for our patients, just because it's a test, that you're waiting to get. And depending on all of the other variables in that equation, level of understanding, explanation, physician-patient relationship, whatever it may be, those can all create different influences of anxiety, if you will. So this has really helped keep that schedule full, keep moving those appointments up, because life happens as we know it, but our job is to make sure that we're providing that care to those patients as soon as we can. And this tool has been really great in that effort.
And a lot of these appointments, I mean, the equipment involved, the technicians, they're it's, I mean, these are significant costs to your organization, right? And tell me a little bit about that. I mean, like a nuclear stress test is not it's not just a regular exam visit.
Right, correct. Yeah, there's all kinds of isotopes that go into it. There's the prep that goes into it. There's those that need to move the isotopes around. There's mobile nuclear. There's the cost of the techs, because those are pretty expensive roles to fill, if you will. So I mean, we need to do a certain volume of those per day in order to break even from a business sense, nonetheless ensure that we're getting the patients all the care that they need. So it's huge in that effort.
Yeah, it's you want to get patients the care that they need, but to be able to provide that service, that important service, you've got to have the volume. That's super interesting. Thank you, Holly.
Sure.
It goes what you've been talking about anxiety and prep and the of people wanting to get these types of appointments, I think goes really well into this next question we have here, which is, what about patients? And we've talked about financial and operational impact of cancellations. What happens when an appointment is canceled and the cost to the organization? But there's also this emotional impact on patients who are waiting for appointments that sometimes without a wait list, without a smart scheduling tool, they may not be able to get sooner. So I want to talk about, in your specialties, how important it is to get patients in sooner, and kind of what response you get from patients when you're able to get them in sooner. Erika, I would love to go to you on this one, because I know you started talking about it. I would think, especially at an OB practice, but of course gynecology as well, this is just a really significant thing. What do you tell me a little bit about it?
Yeah, absolutely. The anxiety, going back to the anxiety and trying to ease that patient, no matter what her complaint is, whether it's routine OB care, to something of extreme of a GYN problem at late past menopause, and they have severe problems that they feel is their priority. So their priority should be our priority. And having that tool in place to ensure that they can be notified, with just needing one word to get in, eases that anxiety.
Yeah. And I mean, it's a serious matter. And we're also, this kind of gamification really does kind of get people to come to it quickly. And they, I think it could be a really big satisfier for your organization to be able to deliver something like that. Holly, what about you? I mean, your heart is your lifeline, right? So tell me a little bit about how patients have responded when, you've been able to get them in for sooner visits.
Yeah, absolutely. So a funny story, I actually have, some of our patients, a mass majority of them are lifetime patients, just due to the nature of the cardiac disease that they they're bestowed, if you will. So, there have been times when there was a physician who's long practicing. And once we started implementing this, they're coming in and their, age is nothing but a number. There was a large thought theory, if you will, that our Medicare population wouldn't take to, the technology of this product in and of itself. Nonetheless, the appointment accelerator, and I can't tell you how many patients come in and like to show us text messages of them responding that they got in, even after they sent their word, thinking that they were going to say some cute, slick joke to us, but they actually, really, really love it, just in the sense that now they have the opportunity without, a human having to call them and let them know that there's availability, because when you're getting 600-700, calls to your organization within one business day, it's really challenging to go back and make sure that all of those just established office visits, annual office visits stay full, because you've got, all of these priorities and we've got a few people to do it. So it's been super helpful in that regard, regardless of age, population, and reason.
I love that. They're bringing in their trophy. Look, I won. I got this appointment. That's fantastic.
Yep.
It is a common concern, across, it's not just intake technology. It's not, you name the technology. There's this innate concern that older adults may not use technology. I'll tell you, our data shows that's not accurate. And I think, Holly, one of the things you've kind of said here is that you actually have more time to spend with older patients because you're saving time in intake, in appointment accelerator, right? I mean, do you feel like you're able to give, especially with your patient population,
Yeah.
do you feel like you're giving patients like more attention?
Oh, 100%. It's not them sitting, in the waiting room doing paperwork for 10 to 15 minutes. They're doing their intake before they get there. They're doing their copay before they get there. So that way their time spent, even though their visit may be for the same amount of time, it's actually patient facing, where they're seeing the practitioner or they're seeing the MA doing their intake or the tech or something of that nature. So it's really utilizing the patient, if you will, to input their information just so they have a more quality visit, which is nice. Because I feel like that we've kind of gotten away with that just in medicine as the time has gone by. So it's cool to see that given back to the patients.
It's fantastic. And I should note that, there still may be patients who need that extra hand. And when you're saving time because you have people doing it before the visit, you've got time, to come out from behind the desk, sit down and walk them through things if they need it. Yeah, we think Phreesia is easy to use. We think a lot of things are easy to use, but it's okay. That's a part of, like you said, Holly, something that's important is being there for our patients. So that's fantastic. Let's talk a little bit about, we've talked a little bit about dealing with cancellations, filling those gaps. I want to talk about, like, kind of take a step back and say getting ahead. Let's talk about, do you feel like your digital intake processes, so that check-in process before the patient gets there, do you think, let's talk a little bit about what those processes look like. And I'm just curious if you think that helps patients like keep those appointments top of mind and prevent the cancellations. Erika, what do you think about that? Do you feel, do you have things in place to prevent these cancellations in the first place?
Yeah, what we do is we have made a broadcast message to go out 2 days beforehand when their appointment is, letting them know our policy. We also have an automatic message thanking them for when they do complete it. Just keeping them in the loop, for that constant communication is always a key.
Yeah, keeping it top of mind. And Erika, you're collecting like copays before the visit as well. Do you think
Absolutely.
do you think that's kind of like, I've given my money and
Yeah,
now?
absolutely. I've given my money. I've committed they've made that full commitment now. So I think that definitely plays a huge piece because, they've already committed. They don't want to have the hassle of wondering about a credit or getting, reimbursed. So I think that definitely just solidifies that it's a done deal. Now it's time for them to get to the office.
That's great. Holly, what about you? How do you see intake coming into all of this?
Sure. Yeah, I definitely, there's skin in the game with it, the time that the patients have taken, paying their copays. We also try to market it to the patients in a sense that if you complete this before you come into our office, it's going to make your throughput much more efficient, although not always the case given, humans. But at the end of the day, just illustrating it that way, especially with our new patients who haven't had an experience in any of our offices, seems to be a large benefit. Also, just again, like going back to a previous conversation, the time that they spend in the office is actually quality time. Not that filling out information isn't quality, but just those pieces there, I feel like they're much more influential on that patient experience, which is what the end of the day is what's going to get you referrals. It's word of mouth at the end of the day. So that patient experience is priority.
Yeah, and I'll just add that when for organizations that are using patient reported outcomes, PROs, and clinical screenings and social screenings, getting that into the intake process as well gives you even better time to spend in the exam, where the doctor's not asking transactional questions, they're asking, they're having a conversation. So that's a really great point. Thank you so much,
Sure.
Holly. Erika, one of the questions we're getting from the audience is, I've got a lot of provider preferences. I've got lots of different appointment templates, and they want to understand how easy these types of scheduling tools, like Appointment Accelerator, are to implement at an organization that might, have some nuances to their schedule, nuances to their providers. Can you speak to any rules or customizations you have on Appointment Accelerator?
Yeah, absolutely. We have a different level of providers. Some providers may do IUDs, but only these IUDs that are out there, or colposcopies. We have some APPs that do them and some APPs that don't. Obviously, all MDs do colposcopies, but there's definitely procedures that are out there that are that putting that rule into play. Definitely prioritizes the appointment need for those patients. So that appointment is not wasted, that it can be utilized to its fullest.
Yeah, it's important to realize that that these kinds of tools are customizable, and we're not just going to, throw a procedure that a provider can't do on that provider. Not every appointment is for every provider, and not every appointment is for every patient either. Holly, I would love to talk to you. You've mentioned you have some structural and timing customizations and rules that you've put in place that are important at your organization. Tell me a little bit about that.
Yeah, sure, absolutely. So for instance, a pattern that we definitely want to try to not disrupt, if you will, is to make sure that if a patient is coming in for their testing results and that testing is done in our office, naturally we need that office visit to discuss those results after that testing has been completed. So a couple of the rules that we have set are pretty basic timeline rules, just if when. So if they have a testing visit scheduled and an E&M scheduled within a certain period of time, we cannot grab those appointments and move them. They come almost as a couple. You cannot split them up or move them whatsoever. We've also have some do not move keywords in play as well, for same circumstance, if you will. So for example, lab results, and we don't do those generally in our office. We send them out and they generally go depending on their plan of care on a particular cadence, right? So 6 months, 12 months, 3 months, whatever it may be for that particular patient. So again, we have a basic rule there that says if it's not been at least 363 days since their last appointment, we won't grab that, instead of having to put do not move on every annual appointment that we schedule. So they are very customizable, but I will take the chance to tell you that I used this to go the other direction, because we have so many ways of doing things, which is great clinically. But when you're trying to take 20, 30 locations and have them all speak the same language, it was a great opportunity to say, okay, everybody does this appointment with this pieces, and this is how we're going to do it moving forward. You don't have 12 anymore, we got 6. So that way we're creating more of a one-line language. So that was a beautiful piece of implementing this as well.
Holly, I've been doing webinars with Phreesia for almost 2 years now, and I can't tell you how many times I've heard someone say, yeah, putting in a tool like this made me get my schedule in order and, standardize across locations. That's really awesome to hear.
Yes.
Yeah, that's
Yes.
great.
Mhm.
Awesome. Definitely kind of helps you align people and get everything in line. I would love to ask one final question before we wrap up today, which is, what advice do you have for other Athena Health users who may be trying to minimize the impact of cancellation at their organizations? Where should they start? Like, what one piece of advice would you give them? Holly, let's start with you.
Yeah, sure. So my piece of advice is to have all of your players at the table when you're going to make a decision of this nature. So have every single person that's going to touch this software throughout the patient journey at the table, discuss all of your challenges and opportunities, and then do your pro and con basic black and white list with Phreesia on how it can help. Definitely great to have, SMEs for every role as well. So you have that peer-to-peer piece in order to lean on. That's a large portion of the success that we have had here, is just ensuring that there is a comfort and good level of education and understanding with the product, because our people are the translators to the patients who aren't getting that. So there needs to be a two-way level of comfort in order to continue to utilize the product and unfold additions to the product, such as Appointment Accelerator. And lastly, I can't see our organization functioning without these pieces. Mind you, I've only been here a couple of years and we've been around 55, 60. But from what I have seen, just in the trajectory of the patient, throughput, patient surveys, copays collected, things of that nature, it's done nothing but progress in a positive fashion. So I just encourage anybody who's using Athena that faces these challenges to give it a shot.
I mean, you may have only been there a few years, but the healthcare industry is far different than it was when your practice was started, when your organization was started. So, I mean, it's far different than it was a decade ago, 2 decades ago. We're undergoing rapid change. So I think it's a fair statement, Holly. So thank you so much for that. Erika, I'll give you the last word. Tell me like what your piece of advice would be to other Athena organizations who are looking to lessen that impact of cancellations.
I would definitely say do not underestimate the impact that this tool, this platform has. Do your research, ask your questions, do the trial if you wish. That's how I started it. I did a trial and I was in love then. So it is definitely a tool that when cancellations impact your schedules and volume needs to be generated, this tool is the one, because it truly can do what it says it's doing.
It's fantastic. Well, thank you so much for that. I'm just going to go ahead and close this out here. I'll put up our nice thank you screen just to thank our audience for joining us today. It's all the time we have, but if we didn't get to your question in the chat, or you have any questions about Phreesia, again, don't hesitate to request a consultation using the form on the right-hand side of your screen. We'd love to be in touch. Thank you again to Holly and Erika for joining us today. And I do also want to send a special thanks to Athena Health for being our host. We appreciate your partnership. Thanks to our audience for joining us. Have a great day, everyone. Thank you so much, Erika and Holly.
Thank you.
Thank you.